Invite Dr. Mumtaz Patel. She is a consultant nephrologist based in Manchester, UK. She has joined us online. She is a postgraduate dean associate for NHS England and has recently started as president for education and training at Royal College of Physicians.
Good evening, everyone. I've just tried to record my session now. Apologies for the AV and IT issues. I hope you're able to hear me okay, and this projects well. So once again, my name is Dr. Mumtaz Patel. I'm the Royal College of Physicians Global Vice President for Education and Training, having just recently completed my Global Vice President role. I'm a consultant nephrologist based in Manchester, and I also work as a Postgraduate Associate Dean for NHS England. I've had the great pleasure of delivering our Global Women Leaders program in Pakistan, and I'm going to talk you through our journey around the background of the program and the delivery thus far. So what's the scale of the challenge? So global women health leaders make up 70% of the global workforce, but only 25% hold senior leadership positions in high-income countries and less than 5% in low middle-income countries. Less than 15% of hold senior academic roles, so the need is great as far as the numbers are concerned, and they're completely disparate. What are the key barriers and enablers? Those are shown in the middle section. The gender leadership gaps we know are driven by work-life balance, stereotypes, discrimination, power imbalance, and privilege. That disadvantage is intersected and multiplied by a number of other identities such as race, class, and what helps is flexible working arrangements, mentorship programs, formal policies around gender leadership, discrimination, harassment, and gender-specific leadership programs, which is what we've aimed to do. Why is there a need for change, which is shown on the final column? Global health, we know, is weakened by the loss of female talent, ideas, and knowledge. That women health often expand that health agenda, strengthening health for all. That disparity negatively impacts on health outcomes for women and children globally. And we know gender leadership gap is a barrier to reaching sustainable development goals, particularly in low middle income countries, and achieving universal health coverage. When you look at the geography of global health leadership, it's all back to front. So the low middle income countries have the highest population at 83% compared to 17% of high income countries. But the leadership within those countries is much lower, with only 17% of senior leadership in low middle income countries and 83% much higher in high middle income countries for a smaller population. Within that 17%, only 5% global health leaders are women from low middle income countries. So huge differences between the percentages. When you look at the World Economic Forum and the Gender Equality Index, Pakistan comes lowest on the Gender Equality Index. And hence in 2020, when I first started the Global Vice President role, one of the aims was to address and start the program in areas of greatest need. And hence we started the program in Pakistan. What has been the work of the RCP in advancing women in leadership, and that's summarized here. So RCP has been addressing this challenge of how to motivate and inspire women towards leadership roles as a key strategic role for the Royal College. And the thematic analysis is presented here around issues related to advancement of women in medicine. And these include practical difficulties, social barriers, and that importance of building resilience through role modeling, mentorship, and support from others. This led to a huge amount of work and development of the Emerging Women Leaders program, which started initially in the UK. And the emphasis of this program was to build leadership capability, capacity, and credibility within aspiring female leaders, and providing that gender-specific leadership development opportunity. And then we did further programs to promote more, supporting diversity within the programs and focusing on inclusion, support, and developing leaders from diverse backgrounds. The Global Women Health Leaders proposal matches very much to our RCP vision, mission, and principles. The Royal College of Physicians' broader vision is to improve healthcare for everyone. The mission statements are shown in the middle around educating physicians to support them to fulfill their potential, influencing healthcare design and delivery, and improving health and care, leading on prevention. And the broader principles are shown there as well, which align very much to our program principles. So the Royal College of Physicians Global Women Leaders Programme was initiated and started in 2021. Certainly the initial thoughts were around that time, and it aims to narrow the gender leadership gap globally. It's mapped to the RCP's broader strategic aims, including its charitable objectives, and it's based on developing both individual and organizational leadership with mentorship support and promoting that system change to enable and empower women to advance into senior leadership positions. We started off doing a global stories across webinar across 4 continents, which we delivered back on International Women's Day back in 2021. We did focus groups in Pakistan in May to June 2021 with key stakeholders, including our stakeholders, potential senior clinicians, and also trainees and medical students. We presented very broadly at a number of conferences so far, and the programme was launched on International Women's Day in association with the Pakistan Society of Internal Medicine on the 8th of March 2022. We've secured funding, we've started and completed the pilot in Pakistan in the first cohort in Lahore, and we're now rolling it out to other regions. We started off the discussion back in 2021 in the midst of COVID times, and we did Global Women Leaders Addressing the Challenge to Advance Women's Leadership in Medicine, and that was across 4 continents, including Pakistan for South Asia. Then we had Middle East, North Africa representation, Sub-Saharan Africa, and the Americas, as well as Europe. And that was a really interesting discussion around key barriers, key enablers to enable women to progress in advancing their career into senior leadership positions. When we did focus groups in May to June 2021, we did that with key stakeholders, senior clinicians, as well as more junior clinicians as well, and medical students. And what came up themes-wise was around individual capability was less of an issue. It was more these cultural barriers. A huge shift in culture was needed, both organizationally and socially, to drive the positive change. There was a need for inclusive organizational buy-in with key metrics for organizational change, more seats on the board, academic positions, EDI committees, flexible working acceptance, and developing local champions. And then more positive things around role modeling, peer support groups, networks, gender-specific leadership programs, which include negotiation assertiveness, and with longer-term mentorship programs as well, both locally and externally. And those are the things that we've tried to enable and include within the Global Women Leaders programs that we started. So we proposed a phased plan to identify and develop champions, both locally, to facilitate that system change, and then provide mentoring, coaching, development, and support to build our support networks. And then we designed and delivered sessions in leadership to include some of these components around emotional intelligence, resilience, quality improvement. And then what we did in phase 2 is we supported the champions to cascade that training across and support locally for program participants and create those networking opportunities with like-minded peers. And the plan is to cascade that down from first cohorts to train the future cohorts. Our current cohorts participants will be our future champions. Our future champions will be our key stakeholders. And then hopefully that cascading following model will help, kind of system build as well, rather than just deliver a program to a small cohort of people. And the program was launched back in 2022 in Pakistan. And this year we launched it in Jordan, where we're starting the delivery of the program next month. The program delivery is a number of events, both in hybrid form, so face-to-face, as well as a virtual delivery. And the number of participants within the program we try and limit so that the impact is greatest. And then the delivery method, like I say, is a hybrid method of workshops, but also online workshops as well. And the overarching ethos of the program is followed the focus group feedback. So we take the feedback on board and then we tailor the program according to the context and the need. And evaluation is key as part of this. So we've developed an evaluation program within it to make sure that, any feedback is taken on board, and then we can tailor the program over time according to need as well. And the program focuses on that kind of identifying self-identity, the lived experiences, which we shared in our workshops here in Lahore as well, which was really helpful. And then looking at the organizational leadership and seeing how we can improve that. And then hoping to have like a kind of a celebrating success kind of networking session going forwards as well when the program is complete. And the focus of the program is on these three main strands. So developing the individual with that focus on identity, lived experience, tailoring to local needs and context, building in that mentoring and coaching and positive role modeling. Then the middle bit is around organizational change and how we can improve that, understanding those organizational structures, how you can be an effective team leader. Quality improvement is a huge part of that. And the whole emphasis is on then driving and enabling system change with key buy-in from locals as well as regional and national stakeholders, and working within and across organizations to drive changes in policy and process, which is really important to drive that culture shift going forwards as well. And the quality impact in evaluation is key. So we've built in a quality impact assessment factor, and this is kind of how we're measuring it with different measurement factors and different target outcomes. And that's how we've written up some of our evaluation reports, particularly from our delivery in Pakistan as well. This shows our program delivery in Pakistan as well. So we had our phase 1 champion development. So 27 senior doctors who came forwards for the role of champion for the Global Women Leaders programs were trained over 2 half-day workshops virtually back in November last year. And they supported us recruit trainee women doctors for the face-to-face workshops that we delivered in Lahore in May as well. For the individual participant workshops for phase 2, we had 63 applications received, and through a ranking system, we narrowed that down to a cohort of 25. And we delivered those face-to-face workshops in May, and these were very well received and quite successful. Then we held a networking event on the last day, which is where face-to-face champions met and delivered some of their kind of learning from their kind of workshops, and they had an opportunity to meet with the participants as well. And then to follow up, we did some online workshops with our participants as well in July. And then now we've completed the program and received a number of feedback from our participants. And prior to the program, 64% of our attendees felt that their confidence in leadership before the program started. And that has gone up to 100% confidence in their leadership capabilities at the end of the program. And lots of lovely feedback, which is kind of shared here, which was one of our participants' feedback through their course. And a number of other bits of feedback around empowering women in health, and lots of nice feedback here that you can see. And then further feedback and nice pictures from our workshop delivery. And it was lovely to see. I strongly believe this workshop empowered me with the confidence and tools to lead a better and effective way. And then amazing learning experience and inspiring to connect. And that was the thing, connecting with all the other women, which is equally powerful as well. And it was a lovely experience for us as well. So the outputs from the champions workshops, and I'm sure some of these will get covered in the other presentations as well. So they've created an advisory board, a research advisory committee. They've created a number of research themes and related quality improvement projects. And again, creation of policy forums as well. We've presented at international conferences, some presentations already delivered and some planned for the coming year. And what we're trying to do from the RCP is build a collaboration and bringing together different organizations. We're stronger together and trying to put, related work streams together under the umbrella of the RCP is what we're trying to do. So women in global health, WHO, women in gastroenterology, Will Ahmed, all these things to bring them together and then work across rather than cross-purpose as well. There's been a number of changes in policy as well since the launch of the program, and this is the collective work of our champions and key stakeholders, and these are shown here. And this is great, that flexibility of daycare within workplaces, having maternity, paternity leave, which is dedicated, and hopefully they're not negatively impacting on individuals' progression as well. So in summary, I feel that I strongly believe that our RCP Global Women Leaders Programme addresses these important gender equality issues. It's mapped to our broader strategic aims. It's based on developing both individual and organisational leadership and promoting that system change to enable and empower women to advance into senior leadership positions. It will help preserve female talent, reduce the gender leadership gap over time, and hopefully help improve those health outcomes for women and improve the sustainable development goals, including universal health coverage in low middle income countries. What we're hoping to do going forwards is take that program and deliver this in another cohort in Pakistan, inshallah, in Karachi, as was mentioned by Lubna and a number of our champions as well. And then we're securing funding for delivery in other countries. So Jordan is second to last on the gender leadership gap, so we're planning to deliver there. And then going forwards, we're having conversation with Eastern Europe, with India, with Sub-Saharan Africa, and inshallah, we can have that snowballing effect over time with our different partners supporting us with this program. So thank you so much for listening. Again, apologies for the IT issues from the other side. I hope this was helpful, and I'd be very open to any questions. And please feel free to email me as well if I'm not able to join more formally. Thank you again, and hoping to see you again very soon, inshallah.